guys, what's up? It's Jasmine here. Welcome to Living with Lupus. And on today's episode, we're going to be talking about drugs and how lupus is treated with those drugs. So if you guys remember from the very first episode, I told you that lupus can be treated, but it can't be cured. These treatment plans are tailored to fit that particular patient. As I said, no one case is the same. It can take years to perfect a treatment plan, and then it's still not perfect because it's so unpredictable that it can still change. You can have the perfect plan going for years, and then you have experience a flare that's nothing like the ones you've had before. The symptoms are nothing like what you've been through previously, and now you have to go and reconcoct that whole treatment plan. So the recipe changes over time. Someone might add a little razzle-dazzle here, razzle-dazzle there. And that treatment plan is made with the patient and their doctor. Now with lupus, the doctor for treating lupus is a rheumatologist. Most likely that's going to be your main doctor. And they are doctors who specialize in diseases of the joints and the muscles. That is one of the bigger target areas for lupus, although it can impact any parts of the body. So you may also end up seeing a bunch of other specialists. For me personally, I routinely see a nephrologist, which is a kidney doctor, a neurologist, which is a doctor for the brain and the nervous system. And I have a story time coming up in later that I'll tell you guys about a really wild experience and why I started seeing a neurologist. In the early stages, like I told you guys, I had a lot of skin problems, so I saw a lot of dermatologists. I don't frequent the dermatologist now, except for like minor cosmetic issues that I'm like being drama about, but otherwise not really that much. But dermatologists are very common with lupus patients. I also see a pulmonologist for that's a doctor that specializes in lung diseases, and I'll talk more about that in the next video when I talk about my flares. And then I see a cardiologist, and that pertains to the more recent types of flares that I've been experiencing as well. So you have a whole team of doctors. For me, my rheumatologist would recommend these different specialists depending on the types of symptoms or things that I was dealing with my lupus. The treatment plan that you develop with your doctor is intended not to cure you from lupus, but to kind of send it into a remissive state where it's not as active and it's kind of under control. So they work to control the symptoms, prevent you from having flares, or treat flares that are currently going on, minimize any damage to the organs, because lupus can be very damaging to the organs, and then to also reduce inflammation. With any autoimmune disease, there's often going to be inflammation in the body somewhere. With lupus, the inflammation can be anywhere. I've had inflammation of the lungs, inflammation around the heart, inflammation of the joints, just a lot. There's a lot of inflammation in the body, and so the treatment plans are to help suppress that and to also suppress the immune system, so it's not as active and constantly sending these autoantibodies to fight your healthy cells. Now we can hop into the drugs that are used to treat lupus. I will say that drugs are heavily used to treat it, and it's not all, it's prescription, a mix of prescription and over-the-counter drugs. So one of the more commonly known and more easily attainable drugs are anti-inflammatories. Those are your non-steroidal anti-inflammatory drugs, NSAIDs. I'm sure you've probably heard of those. So that includes things like your Advil, Aleve, Motrin, ibuprofen, and those are supposed to help with inflammation. So they help to alleviate pain from inflammation, whether it be inflammation around the heart or actual inflammation on the joints. Those are often prescribed to alleviate that pain. And that also includes aspirin. And I myself take a daily aspirin. It's like they call it a baby aspirin. It's 81 milligrams, and it's really supposed to help with protect my heart from inflammation. Up next, you have your corticosteroids. Those include things like prednisone, prednisolone, methylprednisone, hydrocortisone. So it's not just oral steroids, but also topical steroids, which would be like a hydrocortisone, which I've used in the past for like my skin. Corticosteroids are not to be confused with like the types of steroids that athletes might dabble in to get like energy boosts. These do not have the same impact as those other types of steroids. Wish they did. For me, the side effects, and for many people, the side effects of corticosteroids are not cute. It's a lot of weight gain. There's a lot of complications that can come from taking them. I've been taking them since 2005, so going on 15 years I've been taking steroids. I remember when I first started taking them, the doctors would be like, you should never take these for more than a year. And then as the years go on, I'm like, I've been taking these for, a little bit of time now. For me, I find that they are like they quickly alleviate the symptoms. I can be having a really bad flare where I'm like swollen, can't move, and then I pop a steroid, and the next day I'm great. There's great improvement. So they have their pros and their cons. There's a lot of cons involved, and I'll list some of them over here, or over here, one of these places. I'll list them. Like I said, there are also topical steroids, like steroid creams. I use those early on to help with the skin issues. So while I do credit my great skin to my mom, like lathering me and my sister down in Vaseline all the time, like I still mix Vaseline into all of my lotions just because that's how I grew up, like just greasy, like shining like new money. And I still use that mix, so I do credit my mom for that. But I also have to say that using steroid creams did play a role in taking away a lot of the skin damage that I suffered from due to the cutaneous lupus in the beginning stages. Another drug used to treat lupus are anti-malarial drugs, and you may have heard of them more recently during the current state of our nation. Hydroxychloroquine, also known as Plaquenil, is one of the medicines that are prescribed for lupus patients, and it is said to be the medication that you have to take for the rest of your life. There are side effects to it. It's used to treat malaria as well, and I believe tuberculosis. These are actually things that I just recently learned during all that's going on in the world. But there are side effects, like I have to get yearly eye exams because I take them. They can cause you to go blind. They can ruin your vision. So that is one of the medications that is used to treat it. Currently, it is a little bit tricky to obtain. Before I was getting like 120 pills when I would go and get a refill. The last time I went, they could only give me enough for 15 days. Given all that's going on, because it was said to help with that situation. Another drug that is used to treat lupus are biologics. These are drugs that are from a living organism or that contain components from living organisms. So these are things like your vaccines, blood transfusions, stuff like that, or even like proteins. It comes from a living organism, basically. So things like one that is newer to the market that I have actually had, was not successful, but I've had it, Benlysta. Another IV therapy that I currently am on is Rituxan, and it's given every couple of months, and it's given in doses. So I'll get it 1 week, and then 2 weeks later I'll come back and get it again, and then I don't get it again for 4 months. And it's an IV therapy. Steroids, I forgot to mention before, are also given through IV therapy in severe cases where they needed to get into your bloodstream fast. I know a few times I've been dosed like a 3-day steroid kit cocktail. They do call them cocktails, by the way. I remember like when I first got lupus and they were treating me with these IV cocktails. I was excited because I thought I was getting a drink or something, but it was actually an IV. Immunosuppressives are another treatment for lupus, and that includes medications like there's a medication called azathioprine and Cytoxan. Cytoxan is a mild chemotherapy, and I have had that. I will touch base on that later in a story time. But I did do the chemotherapy for 7 months. A few other common medications used for lupus are things like diuretics, which are fluid pills to help keep the fluid off of you, the inflammation off of you. Hypertension pills, so high blood pressure medications, because high blood pressure is common with that. And then anticonvulsants, which are like almost like seizure medications. And I have that story time is also going to touch on that. So I'll talk more about that in the future. But as far as like blood pressure medication and fluid medication, I have also had that in the past. Thankfully, my mother basically they gave it to me for 2 days one time when I was in the hospital, and my mom was like, she's not taking these. Like, she's not going to be taking them, because she knew that a lot of people who take blood pressure medication or fluid pills end up taking them forever, and she didn't want me to get to that state of needing them forever. So she was like, she's not taking them. We're gonna do what we need to do to make sure that the inflammation stays off and that her diet is right. And it was successful, because I have not taken any blood pressure medication or fluid pills since those 2 days when I took it back like 9 years ago. So last but not least, I want to talk to you guys about opioids, which are used in the treatment of lupus and in the treatment of a lot of autoimmune diseases to help alleviate the pain. That is simply what they're for pain. As you guys probably know, opioids are very easy to become addicted to. How they work is they bind your opioid receptors throughout your body, which then reduces pain signals to the brain, basically curbing that pain. The pain is still there, would still be there, but your brain can't really acknowledge it. So they are addictive, and it is very easy to become addicted and overdose as well on opioids. So in the past, I've been prescribed a good deal of opioids. I've had things like tramadol, oxycodone, hydrocodone, morphine when I was in the hospital, just a few different types of opioids, milder and more extreme ones, Percocet, just different opioids. And I can honestly admit that it was becoming a problem for me, to the point where I was just taking them just because I wanted to feel floaty, or just because I wanted to go to sleep, and then it got to the point where I was mixing them with ibuprofen, and I had to wean myself off. It got to the point where my 15-year-old sister had to basically hide the medication in her room, and I would have to ask her when I wanted some. And I quickly, for me, I noticed those signs, and I, sort of just stopped myself. And a lot of times I tried to avoid taking any medicine. I'd rather just pray it away, or mentally talk myself through it, have my mom pray, or I'll call my sister and we just talk. And then by the time we're done talking, I've completely forgotten, the pain is kind of still there, but I've, forgotten that I wanted a pill a second ago. I would be as soon, like the tiniest little inch of pain, like little teeny snippet of pain, and I'm like, oh, I need a pill. And I would take a pill, and literally like 1 second later, as soon as the pill touches my tongue, I'm like, oh, I feel better. And that's how I know that it was kind of like an addiction, or like mental. And so I weaned myself off of those. And yeah, so now I am currently taking tramadol for the pain, and I do not take it like as frequently as I would have in the past. I kind of, scale it out. Sometimes I just fight through the pain. Not fight through it, but I kind of just sit in that pain and talk to God about it, talk to my mom, talk to my sister about it. Just get my mind off of the pain. Thank you guys for your continued support in these videos. Thank you for your likes, your comments, for those of you who have DM'd me asking questions, for those of you who have subscribed to the channel. I truly appreciate it. I hope that these videos have been interesting for you guys and informative. Hoping that you guys have learned a little bit more about me, gotten to know me a little bit more. And yeah, so stay tuned for the next video. If you like this video, give it a thumbs up, and thanks for watching. Hey guys, I'm chewing gum again. Lord. I don't know what I'm saying right now, so I'm just gonna run it back. Can you buy my pills? Can you pay for all my bills? Boy, can you buy my bills? Maybe we can chill.